shootings. And amidst this conversation, we want to highlight some research from the Journal of Clinical Psychopharmacology. It says the following: unmedicated, untreated brain illness is likely in mass shooters. That conclusion, based on the first analysis of medical evidence on domestic mass shooters in the United States, which focused on 35 mass shooters who survived, finding, quote, based on this data, 32 of the 35 perpetrators had signs and symptoms of brain illness, which fit scientific diagnostic criteria for a clinical psychiatric disorder. That from the author of the report, the professor at Stanford University, Dr. Ira D. Glick, who joins me now. Dr. Glick, thanks for joining us on this. Before we have this discussion, I just want to lay out for my audience, this is not to say any of these shooters were victims. This is also not to say that the fault did not lie with them. It is also not to take away the conversation that we are having about guns in this country and the problem with guns in this country. This is a conversation we have in lockstep with the conversation we are also having with guns, and an important one at that. Dr. Glick, thanks so much for joining us on this. I want to say in your report, you note this. Most who are violent are not mentally ill, and most of the mentally ill are not violent. Our message is that mental health providers, lawyers, and the public should be made aware that some unmedicated patients do pose an increased risk of violence. Walk us through, Dr. Glick, your findings here and some of the nuance that exists.
Thank you, Yasmin. These videos highlight the tragedies that families feel. And this, our study was the first study looking at who these people were that committed these mass shootings. And what we found, my colleagues, psychiatrist Nina Cerfolio, Daniel Camus, and lawyer Michael Lawrence, what we found in the 35 of 135 mass shooters, the 35 that lived, what we found is brain illness. We did the first study looking at who these people were and what they're doing. The punchline is, as you highlighted, people with mental illness, quotes, have less chance, less risk of violence. But if you have both brain illness and you don't get treatment, that is, you're acting paranoid, strange, rejected by your peers, no life, no dropped out of school, no work, no friends, you get paranoid. Your brain is sick, your brain is damaged, and you get more and more angry, fearful, isolated, alone. And these are the people who get access to guns and use them to take away lives. Our report is the first to look at who these people actually are and to suggest that what we have to do is help these brain damaged, sick people with a variety of medical and psychiatric illnesses to get the treatment they deserve. Often they reject treatment. These are treatment rejecting people. It's up to us, the families, the significant others, to help get the treatment they need.
Dr. Glick, I got two questions for you. First and foremost is, how much is age a factor here, right? Some of the conversations I've had with other psychotherapists talk specifically about the lack of development of the frontal lobe in men specifically under the age of 25, their impulse control, and that also plays a factor in all of this.
Yes, frontal lobe damage is part of the issue, but the brain is a complex organ, and many parts of the brain are affected. We have parts of the brain that give feedback to stop us from doing harmful things to others or ourselves. Right. So that's only part of the issue.
My other question is, what about resources? You have an individual, you're looking at Uvalde, for instance, there's not a lot of treatment resources. You have two parents, both of them have drug issues, alcohol issues as well. You don't have a supportive network around you. You don't have someone saying, hey, you're sick, you need help, or care to, really, it seems like in this most recent shooter's experience. What then?
There are resources out there. Everyone has access to clinics or doctors of any specialty. The idea is to get the sick person with a sick brain to a physician, not a therapist, that can provide the medication and the psychotherapy that is needed to help these people in order to prevent them from doing harm, in order to save lives for the general public.
Dr. Glick, thank you for your work on this, and I hope we can continue this conversation as it is an incredibly important one amidst all that's going on in this country. Thank you, sir.
Thank you.
All right, up next, our democracy in danger.